Hello everyone. Today I will be present about radiotherapy and its important role in cancer treatment. Cancer treatment has been developing for many decades. Currently we have three main ways to treat cancer. First, there is surgical therapy, which means we physically remove the tumors and affected tissues from the body. Second, we have chemotherapy, which use specific drugs that travel throughout the whole body to target cancer cells. And third, we have radiotherapy, which uses high energy radiation become to destroy cancer cells. Now, here's something very important to understand. Doctors usually don't use just one treatment method. Instead of that, they combine these therapies together because this combined approach gives much better results for the patients. So why do we use these treatments together? Well, when we combine different therapies, we get four major benefits. First, we get enhanced tumor control. This means we can control and fight the cancer much more effectively. Second, we reduce treatment resistance. You see, cancer cells are very smart and they try to resist treatment, but when we use multiple approaches, it becomes much harder for them to resist. Third, and this is very important. We got improved survival rate. This means patients live longer and have better chance for beating cancer. Finally, patients also experience a better quality of life during and after treatment. This multi-modal approach, as well we call it, allows doctors to maximize the treatment effectiveness while improving patient outcomes. Now let me explain how radiotherapy actually works inside the body. Radiotherapy uses high energy radiation beams to destroy cancer cells by damaging their DNA. When the DNA is damaged, the cancer cells cannot grow and divide properly and eventually they become dead. Here's something interesting. Normally healthy cells can repair radiation damage much better than cancer cells. This is why radiotherapy works so well against cancer. There are two main ways radiation damage to the DNA. First, there is a direct DNA damage which happens 30% of the time. In this case, radiation directly hits the DNA and creates breaks, both single strand breaks and double strand breaks. This causes immediate damage to the cells. However, most of the time, about 70% of the damage happens indirectly. The radiation creates the free radicals in the cells. These free radicals then form a reactive oxygen species which cause oxidative stress and lead to secondary DNA damage. Both ways are very effective at destroying cancer cells. There's another important way that radiation therapy works, and this is called hypoxic cell sensitization. Let me explain this in very simple terms. Some cancer cells live in area very little oxygen. We call these hypoxic cells. These cells are usually harder to kill with radiation because oxygen helps the radiation work better. However, radiation therapy is smart. It works by first destroying the protective tissues around the cancer cells. Then it exposes these isolated cancer cells to the oxygen. Once these cells have oxygen, the radiation becomes much more effective. When there's more oxygen around, radiation generates more free radicals, and as we've learned before, free radicals help destroy cancer cells. So this process actually increases the effectiveness of the radiation therapy, making it work even better against cancer. There are three main types of radiation therapy, and each one works differently depending on the type and location of the cancer. First, we have external beam radiation. This is the most common type. The radiation comes from the outside of the body using a special machine called linear accelerators. It is used mainly for breast, lung and prostate cancer. The best thing about this type is that it is non-invasive and very precise in targeting the tumor. Secondly, there is internal radiation, also called brachytherapy. In this method, we place the radioactive source directly inside or very close to the tumor. This works well for cervical, prostate and breast cancers. The advantages is that it gives a high dose directly to the tumor while minimizing exposure to the normal tissues. Finally, we have a systemic radiation. Here, patients receive radioactive substation either by mouth or throughout the IV. This is particularly useful for thyroid cancer and certain bone cancers because radioactive material travels throughout the whole body and targets specific tissues that need treatment. Modern technology has given us amazing new ways to deliver radiotherapy, more precisely and safely. Let me tell you about the four important modern techniques. First is IMRT, which is standard for intensity modulated radiotherapy. This technique uses a radiation beam with variable intensity to achieve better dose redistribution. What this means is that we can shape the radiation to match exactly the shape of the tumor, which reduces the side effects significantly. The next is IGRT, image guided radiotherapy. This technique uses the real-time imaging during the treatment. So why this is important? Well, organs in our body move slightly during the treatment. Even breathing causes movement. IGRT helps us track this movement and adjust the radiation accordingly, making treatment much more accurate. The third is SBRT, stereotactic body radiotherapy. This delivers very high doses of radiation in just few minute treatment session instead of many sessions. It is perfect for small tumor and allows a very precise targeting. Finally, there's a proton therapy. Instead of using the regular X-rays, this technique uses proton beams. Protons have a unique property. They deposit most of their energy right at the tumor and then stop. This means much less radiation exposed to the healthy tissues beyond the tumor. So now let me walk you through the complete radiotherapy treatment process. There are 5 important steps that every patient goes through. Step 1 is initial consultation and imaging. First, doctors do a comprehensive evaluation using CT scanners, MRI scans and PET scanners. This image helps determine if radiotherapy is suitable for the patient and help understand the stage of cancer. Step 2 is treatment planning and stimulation. Here we set up the patient in a specific position and mark exactly where the tumor is located. This ensures that every treatment session will be accurate and reproducible. Step 3 involves the dosimetry and quality assurance. This is where we calculate the precise dose of radiation needed and verify that our treatment plan will work optimally. We double check everything to ensure the best therapeutic outcomes. Step 4 is treatment delivery. Patients come for daily treatment session typically lasting anywhere from 1 to 8 weeks depending on their specific treatment protocol and type of cancer. Finally, step 5 is follow-up and monitoring. We assess how well the treatment is working and manage any side effect to ensure the treatment effectiveness and patient safety throughout the process. So you might wonder why we don't give all the radiation at once. Instead of we divide it into smaller doses called fractions. This is called fractionation and there are 4 types of very good scientific reasons for doing this. The first reason is repair. Between each radiation session, normal healthy cells can repair the DNA damage much better than cancer cells. This means healthy cells can recover while cancer cells don't. Secondary is redistribution. The cancer cells go throughout the different phases of the growth and some places are more sensitive to radiation than others. By giving multiple treatment, we catch cancer cells when they are most in vulnerable position. Third is repopulation. If we give all the radiation at once, several cancer cells might start growing rapidly during the long recovery period. Multiple treatments prevent this accelerated tumor growth. Fourth one is reoxygenation. Remember how oxygen makes radiation more effective. Well, between treatments, area of the tumor that had little oxygen become more oxygenated, making them more sensitive to the next radiation dose. We measure the radiation dose in the unit gray. Typically, patients receive a 1.8 to 2.0 gray each day, and the total dose range from 20 to 80 gray depending on the type of cancer. Like all medical treatment, radiotherapy can cause side effects. However, understanding and managing these side effects is a crucial part of the modern cancer care. There are 2 types of side effects called acute and late side effect. Acute effect happen within the first 90 days of the treatment. This includes the dermatitis, which means the skin becomes dry, red and irritated, similar to the sunburn. There's also mucositis, which is inflammation of the mucous membrane in the mouth or throat. Patient may be experiencing gastrointestinal problem like nausea, vomiting and diarrhea. And finally, fatigue is very common. Patient feel general weakness and tiredness. Late effect happen after 90 days and can be more serious. This includes fibrosis, which is tissue scarring and stiffness. There is a small risk of secondary malignancy. New cancers caused by the radiation itself. Pneumonitis can occur, which is lung inflammation causing breathing difficulties. And xerostomia, which is chronic dry mouth, can be long-term problem. But don't worry, we have an excellent management strategy. We use prophylactic measures, which means we plan treatment carefully to minimize exposure to critical organs. We provide supportive care to manage symptoms during and after treatment. And we do regular monitoring for early detection and intervention any side effects. As we conclude today's video, let me summarize the key point about the radiotherapy. First, radiotherapy is truly cornerstone of modern cancer treatment. It works best when combined with surgery and chemotherapy, giving patients the highest chance of the success. Second, we learned the radiotherapy works through both direct and indirect DNA damage mechanism. About 30% of the damage is direct, while 70% comes from the free radical that the radiation creates. Third, we have multiple ways to deliver radiation: external beam radiation, internal radiation or brachytherapy, and systemic radiation. Each method is suited to specific types and location of the cancer. Finally, modern techniques like IMRT, IGRT, SBRT, and proton therapy have revolutionized the radiotherapy. These techniques have significantly improved the treatment precision and outcome while reducing side effects for patients. Radiotherapy continues to evolve and improve, offering hope and better outcome for cancer patients in worldwide. So thank you for watching our video. Please subscribe our channel for more videos. Thank you.